Welcome to the session. We're diving into the ins and outs of amoxicillin. It's really a staple antibiotic for a range of bacterial infections.
Yeah, absolutely. Right, so what exactly does amoxicillin tackle in terms of infections?
Well, it's prescribed for things like pneumonia, bronchitis, ear infections, and even infections in the nose, throat, urinary tract, and skin. And it's even used in combination to fight H. pylori in peptic ulcers.
So it's kind of like a multi-tool for bacterial issues, huh?
Yeah, exactly. It's part of that penicillin-like class, which means it works by stopping the growth of bacteria.
Yep. But just to clarify, it doesn't treat viral infections like the flu or the common cold, right?
Right on. Antibiotics like amoxicillin won't help with colds or the flu. Using them unnecessarily can lead to resistance, which is a huge concern.
Now, I'm curious, what are the different forms in which amoxicillin is available?
It's quite versatile. You can get it in capsules, tablets, chewable tablets, and even as a liquid suspension. This flexibility means it can be adapted to different ages and needs.
And the dosing frequency is typically every 8 or 12 hours, correct?
Exactly, though the exact timing depends on the infection. It's really important to stick to the prescribed schedule and take it with food if needed to prevent stomach upset.
Right, got it. What happens if someone misses a dose? Do we double up or?
Good question. If a dose is missed, you should take it as soon as you remember, unless it's nearly time for the next dose.
Yeah, exactly.
And never take a double dose to make up for it.
That makes sense. Now, concerning usage, it seems pretty straightforward, but are there any special precautions?
Yes, there are some significant ones. For one, individuals allergic to penicillin or cephalosporin should avoid it. Also, it can reduce the effectiveness of hormonal contraceptives.
Really important. So essentially, if someone is on birth control, they need to switch methods while taking amoxicillin?
That's right. A secondary method of contraception is advised during the course of treatment. And it's also crucial to discuss any other medications or conditions, like kidney or liver issues, with a doctor before starting it.
Yeah, thorough discussion is key. I remember reading something about the liquid form being measured very carefully. How does that work again?
Yes, the liquid suspension needs to be shaken well before each use, and you must use a proper measuring device like a medicine spoon or oral syringe instead of a household spoon.
That helps keep the dose accurate. And what's the rationale behind using a measuring device? Is it really that critical?
Absolutely critical. The concentration in these suspensions is precise, and you'd want to avoid either underdosing or overdosing.
Yeah, indeed.
You know? Each dose is calibrated to optimize efficacy and safety.
Speaking of safety, what about side effects? Are there any that patients should immediately report?
Definitely. Common side effects include nausea, vomiting, and diarrhea, while some might even notice temporary discoloration of the teeth. But if someone experiences rash, blisters, severe diarrhea, or difficulty breathing, they should stop taking it and seek medical attention immediately.
Right, that's crucial. It's like a little warning system, so to speak. Now, I've heard some critics argue that these side effects might be undercommunicated. What do you make of that?
Well, I think it's a valid point to have a transparent conversation. While most side effects are mild, the serious ones are clearly mentioned, so patients and caregivers remain vigilant.
Fair enough. That's reassuring, especially when so many medications have their risks. What about the other practical aspects like storage and disposal?
Yes. Storage is pretty detailed. Capsules and tablets should be stored at room temperature away from heat and moisture. The liquid form, ideally, should be kept in the refrigerator, but can also be at room temperature without freezing.
Got it, that's important. And for disposal, there's a clear protocol too, right?
Exactly. Unused liquid medication should be disposed of after 14 days. And it's also advised to use a take-back program for any medications you no longer need, rather than flushing them down the toilet.
That's eco-friendly and safe. And emergency protocols, like what should one do in case of an overdose?
In case of an overdose, the guidelines are straightforward. Call the Poison Control Helpline at 1-800-222-1222, and if the patient shows severe symptoms, such as difficulty breathing or seizures, call 911 immediately.
Right, immediate action is vital. This really underscores the importance of using medication as directed. How about interactions with other medications?
Yes, that's a key point. The document stresses discussing all other medications, be they prescription, over-the-counter, vitamins, or herbal supplements with your doctor, because amoxicillin can interact with them, sometimes altering their effect or leading to
solid
side
reminder.
effects.
And what about those special instructions regarding dietary habits? Do patients need to modify their diet?
Interestingly, unless your doctor advises otherwise, you generally continue with your normal diet. There aren't any strict dietary restrictions with amoxicillin itself.
Yep, that sounds pretty straightforward. Now, just to be sure, there's also guidance about what to do when you finally finish your prescription.
Absolutely. Even if you feel better, it's crucial to complete the entire course. Stopping too early might lead to the bacteria not being completely treated and eventually becoming resistant.
Right, that can lead to longer-term complications. And they advise keeping a list of all medications you're on, which seems like solid advice for overall health management.
Exactly. It's about safe use overall. Keeping track helps in any doctor visits or emergencies, ensuring that there's clear communication about what you're taking.
That's very proactive. With so many details covered, it's clear the guidelines ensure both effectiveness and safety. It almost reminds me of a detailed map guiding us through the use of this medication.
That's a great analogy. It's like a comprehensive blueprint for treatment, ensuring you know exactly when and how to use the medication, what to watch out for, and what to do if things go awry.
Yeah, exactly. And the inclusion of brand names like Amoxil, Trimox, and others really ties it all together, giving both generic and brand options.
Yep, and it reminds us that while the forms and names may vary, the core action remains the same.
That's right. Overall, it sounds like the guidelines on amoxicillin are as much about empowering the patient as they are about treating infection. Would you agree?
Absolutely. It's designed to be comprehensive so that the patient stays informed from proper dosage, potential side effects, interactions, to even storage. It's like having a manual that covers every critical detail.
Yeah, that depth of information is really beneficial. In our fast-paced world, having such clear guidance can really make a difference in treatment outcomes.
Exactly. And it's reassuring to see that the guidelines also emphasize things like safe disposal and what to do in emergencies, which helps protect not just the individual, but the community and environment as well.
Indeed. So in summary, amoxicillin is a powerful tool when used correctly, and these guidelines help ensure its proper use every step of the way.
That sums it up perfectly. It's about responsibly managing an effective antibiotic, ensuring you follow the instructions, and keeping an eye on safety at every stage.
Right on. Thanks for walking through this detailed overview with me. It's been super insightful and definitely something I'll remember next time I see such guidelines.
Anytime, it's been a fun dive into the specifics. Stay safe and keep that information handy when needed.
Absolutely, thanks.